Coming up on American Medicine Today, the battle for better healthcare is a constant struggle. Dr. Stephen Soloway gives us an inside look at the fight against big insurance and big pharma in his latest book, Medical Politics. Then Brandon suffered a slip disc performing a heroic act while on duty. After suffering through excruciating pain, he sought help from the Bonati Spine Institute and is now happy to return to work and his family pain-free. Finally, Dr. Bonati talks about some incredible advancements that have developed in the field of bionics and computer-brain interfaces. Hear about the exciting technology that is enabling the disabled to move and even walk again. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So a new book takes readers inside the fight against big insurance and big pharma in search of better care for patients. Joining us to discuss is Dr. Stephen Soloway, former appointee to Donald Trump's President's Council on Sports, Fitness, and Nutrition, and author of Medical Politics, How to Protect Yourself from Bad Doctors, Insurance Companies, and Big Government. Welcome to the program.
Oh, thanks so much for having me. It's my honor to be with you.
Certainly. So you've earned top doctor awards every year for 2 decades, so you really understand what proper care is supposed to be. Now, what made you want to expose the corruption you see in healthcare?
I'm sick and tired of seeing patients get the wrong care, wrong referrals, denial of tests, denial of medicine, and everything is just done wrong to satisfy the needs of the guy with the most money who makes the rules, who wants you to be a sheep kept in the closet. You're lied to, you're manipulated, you're stolen from. Your doctor is owned by a facility which is paid for by the government. You can't keep your doctor. The doctors are rotated around. You get 15-minute visits. If it goes over 16 minutes, the doctor will end up getting sanctioned, fired, or quitting. The patient never gets to know the doctor. The care in the hospital is inpatient. It's horrible. The people walk in and out of the room. They speak broken English. You don't know what they're talking about. The nurses are stuck on a computer. They can't leave the computer because they're stuck documenting whatever they're supposed to document to keep their job, but never what's in the best interest of the patient. There's no focus on the best interest of the patient anymore. If people don't get educated about this, all I'm going to do is hear more complaints. There's going to be more unnecessary deaths, more poor treatment, and so on. And the mantra will end up being, there's no more doctors, there's a kiosk, you go and complain to the kiosk, you go home with directions with a pack of gum and have a great life. And by the way, if you get sick, we're not going to help you. You go to the hospital to die, it'll become a hospice, and everyone else will get better on their own.
Do you think that's because we've done away with a lot of doctors figuring we can rush people through and they can become healthcare providers?
Well, first of all, the whole problem with healthcare providers is, one, the training is not up to par like it used to be. Two, the government is diluting the healthcare by, and by the way, in no means do I have any problem with any nurse practitioner, physician assistant, or whatnot. Everybody who works hard, I have full respect for. However, I want to make this very clear. If a person goes to college for 4 years, medical school for 4 years, and does some post medical school training for 4, 5, 6, 7, 8, 9, 10 years, you can't tell me that somebody who does the same thing in 1 year is as good. It's not possible. Even under the auspices of a doctor shortage, that bringing on nurse practitioner, physician assistant, medical students, veterinarians, dentists, and dog catchers to give COVID vaccines and do other things, you can't tell me that these people that are filling in the blanks are as good. They're owned, okay? They are property of the hospital. And that system is in place because the government would rather audit 1,000 hospitals rather than 1 million doctors. Now, this is a terrible situation, okay? I'm going to tell you that prior to Obama and all his good plans, and by the way, the one smart thing that man said, he said that HIPAA was the worst thing he ever did. Well, so I agree with one thing he said. Now, prior to this, 200 million people out of 330 million had private health insurance. 100 million people had Medicare, Medicaid. That leaves you with 30 million uninsured patients. Here, 15 million people have VA insurance and Medicare. Fine. Take away their Medicare and give it to 15 million of the 30 million uninsured. Now you're only left with 5% of the population uninsured. Now you explain to me why anybody would try to completely disrupt and destroy a system that works for 95% of a population, okay? So if you can print $5 trillion to get through the COVID pandemic and still have repercussions for 15 years after, please explain to me why you can't print $1 trillion to fix it would be 15 million people, say, for a 5-year period of time. There's absolutely no reason to have changed or destroyed the system. The only way to get the system back is to put it back in the hands of the citizens and not the government. We have socialized medicine right now, and no one seems to smell or taste it except those of us that are in the field.
It's a push towards communism and socialism. The first thing you have to do is destroy healthcare.
Now, well, we're there. We have socialized medicine in this country, unless you go to a plastic surgeon who takes cash only. It is sad that people are going to have to run and pay for their own and go to the concierge docs, which, by the way, that's not a bad thing. But when you get put in the hospital, the bill is 6 figures or more, and you're still going to be stuck with 20% of that, even if you are a Medicare patient. And by the way, just so you know, all those sweet seniors over 65 on Medicare, they've lost their freedoms as well. Because you know what? Medicare Advantage is nothing more than an HMO. And you no longer have control. Yes, Medicare will pay 80% of what they agree. However, they don't make the decision anymore as to your testing or your medication and treatment. That is left up to the private payer, who is incentivized to not pay. And of course, they're incentivized by the government. Anything that the government likes is not going to be broken up. Google is a proxy to steal your freedom of speech, and these private insurers are a proxy to steal your health care.
Speaking of health care, what goes on with the lobbyist and Big Pharma?
I think you're very well aware that the lobbyists are transferring lots of money to Big Pharma, and things are business as usual. They have more money than I do, so I can't fix the system. So these people keep it broken to their needs.
You decided to, I guess, fight back by writing letters. Is that correct? Who did you write to, and what came of that, if anything?
I've written letters to CEOs of companies, and I've written letters to medical directors of companies. And I've written the letters in the name of my patients that are getting poor care or lack of care. So by me writing those letters, I was actually able to engage with an intelligent person who understands the system and knows, try not to fight with me, because I will make your life hell by having the patients call your house, petition at your house. And all the letters I've written have resulted in an overturn of a denial, which was always in the best interest of the patient. So no, I may be getting fought to death and running out of time to spend during the day, but every time I write a letter that makes sense to somebody in a position of decision making, they cannot dispute the facts.
You actually give some recommendations in your book for a better American medical system. Can you share some of those ideas?
We need to put it back to the people. It's got to be private. I mean, there's always going to be poor people that need some assistance. There's always going to be elderly people that should have some assistance. But the rest of the system was working just fine. People need to make choices. They need to be able to pick and choose their doctor. Their doctor can't be controlled and owned and, passing an agenda that is subliminally stuck in their brain while they're sleeping. And that's the only way I know, is to keep it private and have the patients choose their doctor.
That situation will change only if once for all the people will start to pay for their own care. When they start to pay for the care, they're going to start to scream bloody murder, and then the change is going to change. You do not take insurance, and insurance is going to change. But we need to organize. We don't have American Medical Association working with us. We don't have any type of an organization that's going to fight for us and work with us in behalf of the patient.
Everything that was said was correct.
Well, it is certainly refreshing to hear your take on this. Thank you so much, Dr. Stephen Soloway, for joining us on the program.
My pleasure, and I'd love to come back anytime. Thank you so much.
Certainly. Make sure you stay tuned. Coming up after the break, a story of recovery. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit askbonati.com.
Brandon's an active man and father from Nebraska.
I'm 28 years old. I'm a paramedic, and I do that part-time, and I have a full-time construction company. We do some residential remodels and some light commercial work. I really enjoy jiu-jitsu. It has really helped with my back injury, keeping everything mobile. I've had some back issues in the past. As a paramedic, I would take a lot of transfers, a lot of trips on the roads. The seats aren't really built for good posture.
As a paramedic, Brandon injured his back while performing an emergency extraction of a person at the scene of a serious car wreck.
I just physically removed the patient from the car to get them where I could treat them. At that point, I definitely felt I did something to my back. The back pain impacted my life in every way. I was off work for about 8 months. So I had to sleep with a pillow under my legs. At some points that I couldn't sleep. I probably functioned on like a 20 or 30% level compared to what I normally do. So I wasn't able to do most daily tasks. I wouldn't pick up my children. I wouldn't be able to bend over and tie my shoes very well. Everything took a lot of time getting out of bed, getting dressed for the last 2 years has been very difficult.
Brandon tried numerous conservative treatments, but nothing helped. After seeing a surgeon in his hometown, he decided to fight through the pain rather than undergo surgery.
They did MRIs, X-rays to make sure I didn't damage anything structurally. So I have degenerative discs and then bulge discs and an extruded disc. And basically they sent me to physical therapy. I did chiropractic care. They put me on a bunch of pain meds, which, that don't really help. Basically the neurologist just said we should just do surgery and fuse 3 levels and you'll be good to go. You won't have any more issues. But with 30 plus years left to work, I didn't feel that was a good option. Workman's Comp basically said, get fused or go on permanent disability or be healed. And I said, well, I'll just try to live with it. Being as young as I am, the idea of fusion was not something I wanted to follow through with, just because I knew that as soon as you have a fusion, you're going to have to start adding fusions on either level just because of the damage that's going to cause to each one. I thought I could just work at a very low level and it would start to get better, is what I thought. And so I gave it, about 2 years, and then it just started slowly going downhill, getting worse and worse and worse. And then I decided I needed to do something. I didn't want to do a fusion. And so my wife started looking on the internet, and then I started watching YouTube videos, doing some research, and then decided that this was a very good option, especially being it's so minimally invasive. And the quicker recovery time. As soon as my wife found Bonati Spine Institute, she sent me a link, and I opened it up, super easy, filled out the little questionnaire, and they said, hey, we'll call you within like 2 days. I had a call within like 15 minutes. The process was super easy. They asked a couple questions. Everybody was really nice. And they said, hey, we'll have somebody call up with a follow-up call within the next 2 days. I had that within the next 30 minutes. And so literally we found Bonati online one day, and the next day we had the ball rolling and started everything. The process was started.
After sending in his MRI for review, Dr. Bonati called him personally to say he was a good candidate for the exclusive Bonati Spine procedures.
I never met Dr. Bonati before. He reviewed my MRIs that I had originally, and was able to tell me where my pain was from that. So the feedback I was getting from Dr. Bonati was this is the issue. It was a very big sense of relief to be able to talk to Dr. Bonati, to be able to see that he had a plan, to be able to see that, my 28 years that before, that wasn't all that I was going to be able to function in life. It was a very big relief to be able to realize that, hey, maybe there's a path that I can go forward and I can actually live and do things.
Upon arriving at the Bonati Spine Institute, Brandon received a physical examination and updated his MRIs at the on-campus imaging center. Just minutes later, Dr. Bonati reviewed his new imagery with him and outlined a customized surgical plan to eliminate his pain.
You walk in the front door, you have a receptionist, he points you right to the clinic, they do everything right in the clinic. Right out the clinic, you have your MRI and your X-ray machines, and they're just very close. So it's really nice. Go over there, the staff is very friendly. The MRI machine is a lot smaller than the other ones that I've been in. It was a lot better of an experience than the last MRIs that I've been in. And then you come back in, and they've already reviewed your MRIs. They go through your MRIs with you. The doctor comes in, and they pull it up on a large screen. They show everything. They pinpoint exactly what's going on and show you where, and then talk you through the plan, the treatment plan. Everybody takes their time to make sure you understand what's actually going on.
The targeted Bonati spine procedures are performed incrementally using conscious IV sedation, where the surgical guest remains awake and communicating with their surgeon to ensure their pain is eliminated before they leave the operating table.
They moved a TV screen over so I could watch, which was really, really cool. And they kind of talked me through the process, and it was, I really appreciated it. It was really neat. They would ask me, does this hurt? Can you move this? Can you move this leg? Does this hurt if you move this leg? They asked me to do like a modified push-up, which I haven't been able to do for like 2 years without pain. And I did it, and there was no pain, and that was really exciting.
Back pain should be totally gone.
Okay, so just like a straight push-up or for...
Yeah, push up. All the way up, higher. Then
now arch your back like that.
Arch your back, so a half push-up.
No back pain?
Oh, no back pain at all.
All right, good. Down.
And I did it, and there was no pain, and that was really exciting. I think the surgery is amazing, and being awake for part of it, the idea is really amazing. I don't think anybody should be scared to go through that process. You feel a little discomfort, but you don't really care. It's not that bad. It's not significant. It's not like the pain you deal with every day. You'll feel movement, but overall it's a really neat process.
Brandon, like many surgical guests of the Bonati Spine Institute, was surprised at just how quickly he was able to be up and walking in the recovery room pain-free.
I noticed I could feel my left foot again, and it felt like I had a new foot because I hadn't really felt my foot for 2 years. In the post-op, they brought me in, they put a nice warmer in the blanket, everything was really nice, and a couple of minutes afterwards, they helped you up and they said, hey, let's go for a walk, and I didn't really think I was going to be able to do it, but I got up and I walked, and it was really good. If you're in your 20s and you have back pain, this is a very good option. Please try it before you lose hope. I would definitely recommend the Bonati Spine Institute to anybody who, before you go put hardware in your back, try this, because it is way better. The whole process is streamlined. The amount of work that it takes to actually get this set up there's not much there. It's amazing how quickly the process can go, and really the quickness of how you heal. I'm very surprised at how fast I've healed and been able to get back to kind of just normal daily life after a spinal surgery. At the Bonati Spinal Institute, when I'm done with the surgery, I can walk out and there's no brace, there's no special physical therapy other than walking around and your normal daily life light. I look forward to getting back to work and being able to hang drywall and move trusses and being able to roll in jiu-jitsu and get back on the mats. I'm really looking forward to that, being able to pick up my children without my foot going numb and my back hurting a lot.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced and the recovery time is so much less that it's just a no-brainer.
This is the honest to God truth. And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, you know? So 6 days, and everybody was in awe, like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was rolling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, Dr. Bonati, we've made incredible advancements in motion for those that were paralyzed, helping the blind be able to see. And why is this so incredibly interesting?
I am more and more envy every single day of the young guys that are going to medicine.
Why is that?
The things that they are going to happen in the next century, they are so incredible. What is today science fiction is going to be reality.
And you're jealous, Doc?
Very jealous, man. Very
like,
jealous.
I wish I was starting out right now.
The bionic science is here.
Okay.
It's not very well known yet because it's in the very beginning. But in the University of Southern California in Irving, the scientists there start to just tamper a little bit with the body.
Right.
And then the information of the brain to the body.
Okay.
We need to remember that we have around 100 billion neurons in the brain. And you need to try to understand the connections of these neurons, how fast and how incredible accurate is the information to be able to allow you to just move your body, and something as simple in our daily believing, how enormous amount of information needs to go just to be able to make you walk.
Right. That we all take for granted because it just happens.
Absolutely.
Yeah.
We just go, oh, I'm going to go to my bedroom.
Right.
And just turn and go.
You know what, Doc? As Kimberly just pointed out, it's something you take for granted. As someone who just had knee surgery and was bedridden for like a week, you don't realize, like you said, it's such a simple thing to just get up and go to the bathroom, to take a shower, to walk upstairs, to, you know, so we do take all these things for granted, but what are we doing about it?
So you were making your neurons work.
They didn't want to work, though. I can tell you that.
What is amazing of these people, these fictitious characters decided to create a suit. And that suit was loaded with technology. And then he was able to fly, and he has weapons on it, and all.
Are we talking about Iron Man?
We are talking about Iron Man, am I right? You are not going to believe this. The people at the university, they develop an exoskeleton suit. It's a suit that is out of your body.
Right.
But they are plugging some information to this. And recently they had some people who was paralyzed, and they test the suit. They were able to have some movements.
Okay.
Now, it's not perfect.
Sure.
But they already have some motion. They are not only going and creating that type of a solution for humanity.
Right.
But at the same time, they put the device inside of the retina.
Mm-hmm.
And this,
like an interface kind of thing.
It's a device that was it's a computerized device, but they put it inside of the retina with the intentions to see if they can improve the vision.
For the blind, yes.
And then the blind can see forms.
Yes.
They don't see color, they don't see clear, but they can see forms.
Like shapes.
Yes, and shapes. From there, now they are looking the possibilities to start to make this device to also create the information for color. So if that happens,
life-changing.
Not only that, the blind will be able to see, and with this suit, the paralyzed will be able to walk.
Right.
This is so amazing and so interesting. I'm a surgeon.
Yes.
So I need to move and I need to do things.
Right.
These other guys are sitting in the microscope or sitting in the laboratory.
Leading the way in technology. Being able to have an exoskeleton that allows the individuals that have been paralyzed to interact more normally. I mean, the good that it does for their mental capacity to be able to get up and move and be as normal as they can be. And these computer brain interfaces are nothing but incredible.
But the other thing is how they are making this suit really to interact with the brain.
Yes.
Because it needs to be suit-brain interaction and brain-suit interaction.
Correct.
What they are doing is they are getting information. For example, they are getting people who wants to help on this, okay? Volunteers. And they're getting volunteers to put some electrodes on their brains. And then they record. For example, they say, move the hand to the right.
Yes.
And then the guy moved the hand to the right, and that is recorded.
Correct.
And when it's recorded, it's computerized. And then this element, they have some electrical type of a motion of this information.
Yes.
And that information now is being placed in a certain way that they say, okay, to move the hand to the right, this type of electrical behavior, this electrode needs to have.
Right. So you
and
can mimic.
Those are putting on the suit.
Correct. And that's what can mimic a more natural motion. I'm sure we'll continue the discussion in further episodes. Make sure you watch us Saturday, 4 p.m. Eastern on Newsmax. And if you've missed a previous episode, check out American Medicine Today on YouTube. If you have any comments or questions, contact us at the number below. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.